Hello everyone, I'm Dr. Aaron Meir. I am the owner and medical director here at Orchid Aesthetics and Wellness, and I have Katie Davis with me. She is a nurse practitioner that has been working with us for a little over a month now, and she's just learning the lay of the land. She's building up her clientele and learning how to put up with me. So anyway, so Katie is a seasoned nurse practitioner injector. She's proficient in all types of neurotoxins, including Dysport and Botox, all types of dermal fillers, PDO threads. She's also very skilled in bioidentical hormone therapy and wellness, and as well as PRP. So we are very honored and grateful to have her here at Orchid Aesthetics. She's going to do great. So today we had a little time, so we're going to do some Botox. So my forehead and glabellar lines really need it, so we thought we would do a little video just to kind of describe what we do as far as Botox, and we're trying to get more men involved with aesthetic procedures and Botox. So guys, this isn't just for women, so come on and let's do it. So you ready to get started?
Yeah.
Okay.
So you can go ahead and lay down. I was just going to talk about kind of what Botox is. That's kind of the first number one question that I always get asked. So whenever we inject Botox is a neurotoxin. So whenever it's injected into whatever muscle that we're trying to treat, it's going to inhibit the contraction of that muscle and relax that muscle in whatever area that patient is concerned with. So when doing that, it will soften any static or dynamic lines or wrinkles that patient has, and that will last typically about 3 to 4 months. Every patient is different, but that's the pretty standard time frame. Before coming into the procedures, I do like people to try to avoid taking any NSAIDs or blood thinners that you might be on. Otherwise, after the procedure, we want people to remain upright for about 4 hours afterwards. We also want you to avoid any strenuous exercise the day of the injections. I also just recommend that people avoid trying to massage or rub your face, especially about 24 to 48 hours after the injections, just to make sure that product is staying where it's intended to stay. So we'll go ahead and get started.
And it has been about 4 months since I had my last, so anything that I have had is completely worn off.
All right, so I always just clean my patients off with an alcohol or a hypochlorous acid. So we'll clean the areas that we're gonna be treating. And then I always mark my patients off with a marker or pencil just to, have the precise injections of where exactly that I wanna be injecting. So I'll have you go ahead and bring your brows together like you're angry. Perfect.
So as you can see, she's got a very systematic way of where she's marking, and where you put this product is very important. I know there's a lot of people doing Botox right now, and but the injector really does matter, because where you put this product is key to how it's going to work and how it's going to function, and all these muscles work together, so getting the proper dose is also important.
So we're going to go ahead and get started with the injections here. Just go ahead and relax. 1, 2, 3.
I mean, guys, this is a minimal amount of pain. It's not even pain. It's just a little tiny needle stick. I know a lot of people have a needle phobia, but this is, and I'm a wuss, by the way, so.
So when I'm injecting, I'm also kind of just trying to look for any vessels in the area that I'm injecting to try to, decrease the risk of any bruising. So again, just going to a skilled injector that looks out for those kinds of things is important.
Mm-hmm. Absolutely.
All right, and that is it. As you see, there's minimal bleeding, so he shouldn't have any bruising at all. With the Botox, one thing to keep in mind is that it does take a full 2 weeks to kick in. So you will start to gradually notice improvement, gradually each day after the injections. But I always tell people, please wait the full 2 weeks until you really start to get that full effect from the Botox. again, the biggest thing is really just trying to avoid manipulating any of the areas injected. We really want that product to just kind of stay in the muscle that we were trying to target. I always have my first time patients and try to have all of my patients come in at that 2-week mark, and we can do any touch-ups if needed at that time.
So we did do some before pictures, so we'll have those, and then in 2 weeks we'll take some after photos and we'll see the vast difference. So thank you, Katie. Appreciate it.
Thank you.